We are here today for a very special occasion, the opening of the Veteran Administration and Department of Defense Health Clinic, the first of its kind in the state of Kentucky. Our partnership with the VA is so important that we share a mission to care for those who protect and have protected our country. This clinic demonstrates that shared commitment to the continuum of care that stretches from the first day of service throughout all the life of the service members long after they leave the force.
That's one of the beauties of this partnership, is it's actually a partnership. The VA clinic is only utilizing our space. They're using their own VA providers and expanding the care to our community, expanding it to the veterans without impacting the number of providers that we have here at BACH. So the beauty of it is it won't impact the access to care or any services for our beneficiaries, but it will increase the access to care of our veterans already on Fort Campbell so they can easily access medical services in their health care.
The VA takes them from when they leave the services and then they become a VA beneficiary. But we want to make sure that that is seamless and that the two departments work together to deliver what we promised we were going to deliver, right? So this is another exercise on that commitment. So we're looking for opportunities where both the Department of Defense will benefit, but above all, the patients we serve benefit, right? So it's about patients.
We're committed to doing more in this space. This is just the beginning. I highlighted that in my remarks earlier today. This is a big clinic. It'll be amongst our biggest outpatient clinics away from our hospital campuses that we have in our inventory. So it's a big deal for our staff and our team as well. And we're excited to be able to provide more specialty care and other ancillary services in that bigger space as well.
We have a process. We meet very frequently with the Secretary of the VA to accept places where we can expand care, and this is one of those. And I'm here just to celebrate that partnership we have with the VA. And in this case, number one, our patients, whether they are DoD beneficiaries or whether their VA is still there, our patients, right? We're serving them. Number two, our clinical staff may get the benefit of having complex patients, and that is part of the readiness for us. And number three, the whole community thrives and does better.
We're looking at these first couple projects. We just announced one at Pensacola recently in Florida as the foundation for how these types of projects can accelerate across the country. So we have 12 similar ones already in the works. And we want to make the most use of DoD infrastructure that we can to serve veterans, but also contribute to the readiness mission of the clinicians in active duty, to contribute to that part of what DoD is trying to do as well. And so I think this is just a really effective way to use resources and assets that already exists. And the end goal here is just to expand access to care for vets.
It's like the three legs of a stool. You cannot work one without the other. So in this case, as we bring patients in, we give opportunity for training of our medical personnel to get proficient clinically. So if they're asked to come forward, they will be ready to do what we ask them to do. So in that case, the patients win, the readiness wins, and the whole, again, our patients win. So how can you go wrong there?